radiologist here based in Singapore. So I was hoping basically to learn more about artificial intelligence in respect to mammography, also improve my biopsy skills with the hands-on workshop, and lastly also to further enhance my knowledge with the MRI breast, specifically abbreviated MRI breast. Well, I think this is the first program that I've ever attended where there's actually a very strong emphasis and incorporation of the AI component and how it improves the workflow for a radiologist with regards to mammography. And this has been really eye-opening how far advanced AI has come. And also with regards to the breast intervention workshop, it gave me an opportunity to see that they now actually have wireless vacuum assisted biopsy machines, and it's a great step forward. And lastly, of course, the MRI breast side, it's good to see actual implementation of abbreviated breast MRI protocols and how fast we can do scans nowadays to improve patient screening a larger group of patients and make it more accessible. So I think it's definitely improved my confidence in terms of ability to upgrade or downgrade lesions which were previously I would have categorized as BIE 3 lesions. So that is a great thing that is taken away from this course. I have never actually attended any previous workshop where I have been able to do hands-on biopsies of breast intervention. So this is one of the courses, specifically when it comes to MRI breast intervention. And we have that, and it's good to see how they technically teach step by step, every step along the way. You have got faculty who was teaching me how to do MRI breast, and we had a chance to actually use the Phantom model and everything. And yeah, it was fantastic. I think the quality of the cases were fantastic, and of course the answers provided as well, the explanation, and of course the faculty, if there's any doubt which was maybe sometimes not included in the answer sheet, faculty were always more than happy to actually give an more thorough, personalized explanation in terms of why they came to the decision that they made. I would give them all 10 out of 10. To be very honest. Mainly because of the faculty, really give very personalized attention, good case mix as well, and the venue, organization, everything was really spot on. I would highly recommend it to all participants, regardless of level of experience with breast imaging. Of course, I think it really helps if you're already coming with a stronger foundation. But even then, with the pre-course learning materials that are there, people can at least have a reasonable foundation to start off with, launch themselves into